So I wanted to start by talking a little bit about this situation with COVID tests and the Biden administration's late response. Just to go over some of the background before we get into the latest update. Some of you may remember a few weeks back, Press Secretary Jen Psaki was asked about this and literally laughed, like gave her visceral response was to laugh at the notion of providing American citizens with COVID tests. And to put that in context, many countries around the world have long been offering tests and masks and other strategies to try to combat the spread of COVID. But to the Biden administration, that was a laughable concept as they tried to force everybody back to work and force everybody's kids back to school and act as though we are somehow on the other end of this pandemic while over 1 million Americans have COVID. So their initial response was to literally laugh at the notion of giving out COVID tests to people. And it slowly kind of evolved, right? So from there, they got blowback and realized that that probably was not a great position to take when most of what they ran on was being competent on COVID, unlike Trump. So they came out with a plan that basically forced private insurers to cover COVID tests and reimburse those who are covered on private insurance for COVID tests that they had previously bought. So leave out the uninsured, leave out the poor. And by the way, this plan also did not force any of the Medicare plans to cover the COVID tests either or reimburse for COVID tests. So Medicare, of course, covers who? Seniors, the elderly, people who are among the most vulnerable to this virus. Brilliant stuff from the Biden administration there. Per usual, screwing the poor and then touting it as some sort of accomplishment. Who needs COVID tests more than anybody else? Who cannot afford to miss work if they're feeling iffy, right? The wealthy and largely the upper middle, the professional managerial class, whatever you want to call it, can afford to like err on the safe side. Sorry, I'm really not going to come in today because I'm not feeling great and I haven't been able to access a test, right? So who really, really, really needs access to the test? The most impoverished people who cannot miss a day of work if they want to pay their bills, and people who work in environments where missing time is not culturally acceptable, right? Those are the workplace environments that most need those tests to say, no, I really need to stay home. I just tested positive for COVID. So who does Biden leave out in this initial plan? The impoverished and the elderly. Brilliant stuff. So then it evolves again, and we now are to the point where they are offering free tests directly from the federal government. So you can go online and order tests. There's a limit per family, but you can go online and order tests. So this has evolved. So I want to cover this for a couple of reasons. First of all, if this had been done weeks ago, we'd be in a much better place, right? By the time this program actually kicks up, we're going to be so far into this big wave of Omicron cases that it's just significantly less effective than if it would have been done months or even weeks ago. So it's per usual with Democrats. They drag their feet and while they're being pressured by progressives in the left, and then they do like the bare minimum or even less too late, and then they call it leadership and demand credit. And this is exactly what they did. The Democrats' official Twitter account posted out a clip of Joe Biden and said, this is leadership because we're giving out free tests. So you're behind the rest of the entire planet practically. You drag your feet for months while everyone's telling you, hey, maybe you should give out tests. That's not a bad idea. And then you turn around when you finally concede and fold to that pressure, you turn around and you want credit for it. You're not leading, you're following. You're following the political winds, right? So anyhow, I just wanted to make sure that context was clear, and we'll dive in here to the details because I do want to make sure that people know how to engage in this program should you need a COVID-19 test. So this is in Politico. Biden administration to start offering free at-home COVID tests on January 19th. A senior administration official told reporters the government has 420 million tests under contract and tens of millions already in its possession. I believe the total order was like two $500 million orders. So I think he said he was going to get to 1 billion tests. Okay. So again, you guys, I want to make clear how grossly inadequate and how late this is. It's too little, too late. But I do want to make sure my audience knows how to participate in this program if you need free COVID tests. So we're going to read here. The Biden administration will begin making free at-home COVID-19 tests available through a government website starting January 19th, but the public may have to wait a week or longer to receive them. Households will be able to order 4 tests at a time through the website covidtests.org, covidtests.gov, and the tests will typically ship within 7 to 12 days of ordering, according to a fact sheet. A senior administration official told reporters the government has 420 million tests under contract and tens of millions already in its possession. Officials are finalizing contracts for the 80 million tests remaining out of an initial order of 500 million. The effort to procure and distribute the tests will have a total cost of about $4 billion. Who the fuck cares? As we talk about often at Real Progressives, modern monetary theory teaches us and informs us that currency issuing governments can afford any program they wish to spend on. Asked if the government can meet demand as soon as the website goes live, the senior administration official told the Biden administration is confident that we can meet all of our timelines and get these to all Americans that want them. We anticipate the first test going out at the end of this month, with the remaining tests going out over the next 60 days. Health and Human Services Assistant Secretary for Preparedness and Response, Don O'Connell, told the Senate Help Committee during a Tuesday hearing on the pandemic response. Data. Excuse me. Nearly 3 million results from COVID-19 tests are being logged daily, according to a tracker maintained by Johns Hopkins University, but public health experts warn that that number does not include millions of unreported results from at-home tests, which are not frequently shared with public health departments. A White House spokesperson told Politico the federal government will not be putting new systems in place for Americans to report results from the free at-home tests being distributed outside existing reporting structures. As I noted here, they're attempting to order another 500 million to add to this program. So if you need free tests, do go check that website out. As grossly inadequate as this is, as slow as this program seems to be, and as late as all of this is, if you need tests, please go check it out. I wanted to briefly address this narrative that I have seen that seems to be an attempt to minimize COVID. And what I mean is, people will say that the reason the case numbers are going up, they try to argue that the case numbers are bloated because people are going to the hospital with other ailments and then testing positive for COVID. So they're trying to say, like, see, it's not really making people sick. We're overstating the number of cases that quote unquote matter. And I wanted to address this, you guys. This is just patently untrue. Throughout the entire history of pandemics, we know they are always underreported. And the reason for that is, regardless of the technology you have at the time, your testing system, your infrastructure can never keep up with a contagious virus. It just can't. So, for example, I had COVID a couple weeks ago. Okay, I tested positive on an at-home test. There's no record of that happening. I had COVID, but I'm not part of those million cases that were documented, right? That is replicated over and over and over again throughout this country. And there are people who don't even think to test because they don't have symptoms, but they are positive and they are spreading it. So we know the numbers are always going to be low. Right? We should still try to compile data for the sake of public health policy and things like that. But the idea that because people are going to seek medical care for other reasons and then testing positive for COVID, the idea that that's somehow indicative of bloated COVID numbers is quite exactly backwards. It actually, it shows you how many people are walking around with no idea they have it. Because people are showing up to the hospital and saying, I have X, Y, or Z, not saying they have COVID, and yet they have COVID. So it's actually proving just how underreported these cases likely are. Okay. Now, I'm grateful to whatever extent Omicron is not providing as bad as symptoms. That's good. That's good news, and I'm happy to see that. But I want to make sure that my audience understands that treating it as mild is grossly irresponsible for those who may actually suffer from it. Long COVID is a very real thing, and a lot of people are posting about how they're still dealing with long COVID, even though they didn't have horrible symptoms while they actually had COVID, right? Or initially when they caught it. So there's all these other complications that we don't totally understand. There's been evidence of long-term organ damage and nervous system damage and things like this that we don't fully understand yet because it's still too new. So to treat it as mild and just sort of accept that it's endemic and that everybody's going to get it is not, in my view, a very responsible approach to the problem. Okay, I just want to encourage everybody to take it seriously, to treat your fellow community members with the respect that you would want them to treat you and your family with. Wear that N95 mask if you can get your hands on it. Distance from people, wash your hands and sanitize, get vaccinated if you haven't been vaccinated, support public policy that includes early treatments and all that stuff, funding for treatments, all that stuff, public health infrastructure. There's a lot that can be done, okay? And I'm upset with the Democrats and the media for centering their entire strategy and narrative around the vaccines without acknowledging all the other strategies that could be used and implemented to try to stop the spread of this thing. So Biden, too little, too late. I'm glad that the pressure in some sense worked. Like, it's better to have this free testing program now than never, but don't give Biden credit for that. He's folding to the pressure. Their initial response was to laugh at this, you guys. Jen Psaki laughed at the idea of giving out COVID tests to American citizens for free. So go to that website. I wish I could remember what it was, but I just read it in that previous article. If you need some tests, it's good to have some around in case you start having symptoms and need to test as quickly as possible. But I again want to point out, you guys, that the people we leave behind, the people who most need these, are the impoverished, as with almost everything in our society, right? Because they're the ones who can't afford that day off work. They're the ones whose boss is demanding that they come in unless they have a positive test. Okay. So this is part of any reasonable strategy to combat COVID is getting tests widespread and having access to tests for absolutely everybody. And shame on the Biden administration for being so far behind in this and for being so callous in their initial response to the very suggestion that they, create a program for free COVID tests. So I would like to see the narratives around this stuff settle down a little bit. I've talked about this at length, so I won't go into it here, but I'm sure many of you know my opinions on this. It's a public health issue. It's a science issue. It should not be treated as a part of the culture war, but that's exactly how it's been treated. So I just want to encourage everybody to take the updating science seriously, take the medical advice seriously, listen to biologists and doctors on this stuff. You guys don't listen to your favorite YouTube commentator, me included. Okay, go listen to the experts on this stuff and participate in any strategies that can help keep you, your family, your loved ones, your community members safe from this disease.